Cheryl's been diagnosed with kidney disease, but she's having trouble managing her health. She's tired and sometimes gets depressed. Lately, she's been experiencing some shortness of breath and her legs are swelling. Cheryl's doctor talks with her and her husband, David, and suggests that Cheryl get palliative care. But they begin to cry because they think the doctor is telling them that Cheryl's dying. Many times patients are scared when they hear terms that they really don't understand. In Cheryl's case, the only time she and her husband had heard of palliative care was when David's father was dying of cancer. They associate palliative care with hospice care and came to the wrong conclusion that she was at death's door. Cheryl's doctor spent the next 30 minutes explaining the difference between hospice and palliative care. He also discussed Cheryl's goals of care and the importance of an advance directive so that Cheryl can make sure that David and other family members know exactly what it is that she wants for her health care, especially if there came a time when she couldn't speak for herself. Now, there were a number of important terms that the doctor explained in this conversation. He told them that hospice is specialized care that's appropriate for patients who have a terminal illness and will likely die within 6 months. This service is not only available to cancer patients, it's available to anyone of any age suffering from a terminal disease. The focus of hospice care is on keeping patients comfortable, not curing their diseases. Hospice care is delivered by a team of healthcare professionals, including physicians, nurses, social workers, chaplains, and others. A core value in hospice care is that each of us has the right to die pain-free and with dignity, and that our families will receive the necessary support to allow us to do so. Palliative care is often confused with hospice, but they are different. Whereas hospice is appropriate for terminally ill patients, you don't need to be terminally ill in order to get palliative care. Palliative care is an extra layer of support that's provided by a healthcare team to patients of any age who are facing serious illnesses, no matter what their diagnosis. Palliative care is offered in addition to traditional medical care, and it prevents suffering by addressing pain and other symptoms, including the physical, emotional, psychosocial, and spiritual problems associated with serious and chronic conditions. It can be provided along with curative treatment, and this is a key difference from hospice care. Cheryl's doctor believes that her depression and discomfort could be relieved with good palliative care. Her doctor wants Cheryl to enjoy the highest quality of life that she can. Now, they also discuss Cheryl's goals of care. This is a conversation where patients tell their doctors about the kinds of care they do and don't want, and under what conditions they would make these choices. This helps Cheryl's doctor to align her treatment with her wishes. Cheryl was able to tell her doctor how she wanted to be treated and the kind of comfort she was looking for. Doctors can take the time to discuss goals of care with patients as part of advanced care planning conversations. This will help to ensure that patients have the opportunity to make thoughtful decisions about their health care. It's also important that all of us over the age of 18 complete an advance directive for health care. This document consists of 2 parts. In one part, we choose the person we want to be our healthcare advocate, and this person has our medical power of attorney. This is the person who would speak for us and make healthcare decisions in the event that we couldn't speak for ourselves. The second part is the living will. This is where we outline the kinds of treatments we do and don't want. For example, some people don't want to be put on a feeding tube. By documenting your wishes, it's less likely that you'll be given treatments you don't want. You should be sure to make copies of the advance directive for your healthcare advocate, your physician, other loved ones, and be sure to keep a copy for yourself. You can change the advance directive at any time, just be sure to destroy old copies. By taking the time to complete this form, you'll be more likely to get the kinds of care you want and avoid the kinds of treatments you don't want. So here's a caregiver tip. Talk with your doctor about completing an advance directive for health care for your loved one and for yourself. You don't need a lawyer, and it costs nothing to complete this form. Your doctor will be able to direct you to the appropriate form for your state. If you're interested in getting palliative care for your loved one, ask your physician. Doctors should be able to direct you to palliative care services in your area. If you'd like more information about palliative care, You can also contact the CSU Institute for Palliative Care at the address on your screen. Our mission is to educate the community about palliative care and to help train healthcare professionals to provide the highest quality of care for their patients. In this Family Caregiver series, we've focused on the many challenges we face in family caregiving, but there is a positive side. Watch our next video to find out more about how to make the most of your caregiver experience.